for over 50 years. We presently have more than 10,000 partners across 100 countries. You can't always see Zebra, but you can always know that Zebra's working behind the scenes. We like to call it, where do you see zebras in the wild, right? So on your day-to-day business that you go about, you might see Zebra with your rental car receipts, price markdowns, any major retailer doing any kind of inventory scanning, you're going to see Zebra solutions and handheld devices. As arenas open up, which I'm really excited about, we start going to concerts again and shows and sporting events. If you go in and ever had a ticket scanned, it was most likely scanned on a Zebra mobile device. And if you were lucky enough to go to an NFL game, a lot of the stats that were collected from Zebra's technology solutions with RFID tags actually under the players' pads and even in the football itself. So, or delivering packages to your door usually involves some of Zebra's technologies. But most importantly to this audience, Zebra is inside most major hospitals in this country in some form or fashion, our technology, and medical centers really around the world. So if patient wristbands, specimen label printing, as you can see from the slide, location solutions tracking, barcode scanners for med admin, and then of course our mobile devices for communication and collaboration. So that gives you a little bit of an idea of where you might see Zebra in the hospitals. So Zebra is honored that we get to work with our healthcare community and to implement and develop these leading edge technology solutions. So with that, I'm going to introduce our moderator and our 4 panelists. It's my privilege to introduce the next panel on the topic of navigating with new technologies. Moderating the discussion is Christian Aboujaoude. Christian is responsible for the strategy, architecture, engineering, and operations for all computer infrastructure at Keck Medicine of USC. I've also gotten to work with Christian over the past year, and welcome, Christian.
Thank you.
And you're welcome. And then now we have 4 panelists. I was reading their bios last night and I was blown away. We have a great panel here. Dinesh Seemakurty, founder and chief product officer of Stasis Labs. Dinesh has clinical training as an emergency medical technician and has a passion for internet connected technology, which drove him to found Stasis in 2015, providing remote patient monitoring. Welcome, Dinesh.
Thanks for having me.
Yeah, this is going to be great. Our next panelist is Jaden Risner. I believe that's Risner, co-founder and CEO of Family Proud. Family Proud is, I guess I can start my video now. Sorry about that. Family Proud is a family care management platform connecting patients and families to community and resources critical for their care. Jaden is also a Navy Reserve pilot and continues to serve both his country and his community. Thank you and welcome, Jaden.
Thank you.
All right, our next panelist will be Ariel McNichol. Ariel is the founder and CEO of MotiSpark. Ariel is a creative director and user experience pioneer who co-founded and scaled multiple startups. Ariel has done content creation and design work for global brands such as Apple, Disney, Scientific Learning, Now.com, and many other large global brands. Ariel's work has helped define what is now the norm for what we all are familiar with: microblogging, avatars, emojis, online video consumption and engagement. Welcome, Ariel.
Thank you.
And our last panelist that we're going to have today is Guillaume de Zwirek. Guillaume is the founder and CEO of Well Health. Guillaume founded Well in 2015 out of exasperation with the inefficiency of communicating with his healthcare system while living in fear of cardiac arrest. He has since made it his mission to transform healthcare, renowned for customer service. Welcome, Guillaume. And with that, thanks again from Zebra Technologies. And now I'll turn it over to our moderator, Christian.
Thank you, Kathy. Appreciate it very much, and welcome everyone. And I am very fortunate to be part of this panel this morning. I can tell you that when we were prepping for this panel, it was amazing because the amount of content that we were going to cover, we would probably need 3 hours versus about 35 minutes or so. So I'm very fortunate to be hosting this today. Good morning to everyone. And really, a couple of the areas that I'd like us to kick off with has to do with looking at the healthcare spectrum as we have, look back a couple of years and look forward a little bit. What an incredible amount of change that we have gone through as patients, as providers, as consumers of different services in the healthcare space. And really, as a result, technologies have evolved pretty significantly for us. And more significantly, the most significant rather, evolution really has to do with enabling the patients, right? The patient's ability to capture data about their health, being able to communicate with their providers, being able to exchange back and forth various different content that make them either feel comfortable or feel empowered or feel educated about what's going on. But yet, through all these enablements that are going on, there is still a lack of somewhat uniformity and standardization across the board as we talk between the provider and the patient. That's on many different fronts and for many different reasons. So what I'd like to do this morning is kick off this panel with just a simple question. When we look at the digital environment, right, the grounds that's gaining rapid speed in offerings and what have you, really, what are those foundational elements, right, that providers must adapt to enable that proper integrations with our patients in a friendly fashion, but also we have it be actionable from a data-rich environment? And how are those taking place between provider and patient? So if I can maybe start off by calling on Ariel first to kick us off, and then we can certainly open it up to the rest of the panel.
Great, thank you, Christian. I think as we move towards more digital engagement, that we've seen this opportunity and need to help the local providers be able to sort of scale their caring touch through technology, whereas not necessarily replacing it. So we allow these sort of like asynchronous video messages that come with all this other content. But I think enabling providers to easily onboard patients into digital experiences is necessary, so it doesn't feel like, here's my doctor, and then I go and here's some app with a whole bunch of stuff that is completely disjointed from my in-person care. And there's data around how hard it is for people to remember what they're told when they're in their actual like live session or in-person doctor's appointment. And so as much technology that can reinforce that care in different modalities, we think is really powerful.
No, that's absolutely true. How about the rest of the panel? Any additional commentary or questions?
I'll hop in. Yeah, certainly extremely important from an integration aspect to certainly meet the families where they are. I think a lot when we talk from an integration standpoint, you think whether from technology or clinical, but so important to understand your audience, of course, varying degrees, whether from a community, the language they speak, the culture, really taking into account those social determinants and being able to target those integrations to account for those specific needs of the community and really look for ways to bridge those gaps and meet the families where they are. It's extremely important from a patient perspective, and then accounting for who's around the patients from a support aspect. It's not just the patient, but the family that surrounds them, supports them, that's going to help them through that entire continuum of care.
And Jaden, I think you touched on an interesting point with integration. I agree with everything everyone said, but I think if we take a step back, as I look to people like Christian who do a good job on this, but folks who have similar roles in other organizations, whether you have 3 doctors you're supporting or 3,000, integration is the backbone to all of this. If you don't have the staff and support infrastructure within your organization to spin up data feeds, VPN tunnels, to allow next-gen best-of-breed vendors that can reach your patients where they're at, you can't even get in the game. So the organizations, and we've worked with a variety of organizations, the ones that end up being the most innovative are the ones, this is going to sound really basic, that can spin up HL7 feeds really quickly, who have a common framework for doing that, a team available to do that, whether it's HL7 Fire or API, just having that supporting infrastructure within your organization I think is the key to unlocking any of this, amazing innovation that we've seen adopted over the last year.
What do we think, if I can ask just a follow-up question to the panel, what about the standardization of how these solutions are, absorbed into someone's environment? Any feedback or commentary on that portion?
Well, we've seen the EHR. Oh, go ahead, Jaden, go ahead.
No, please go ahead.
I was going to say the EHR is the first one who's really done standardization, right? When you think about, let's go back to my point about HL7 feeds. If you are a vendor selling into healthcare, there is a standard for data. The CTO, the CIO is probably telling you, can you integrate with Cerner, Epic, Meditech, whoever their EHR is? I think there are other abstraction layers that need to be thought about and built and maintained. Think about like a single patient identity, right? If you have built a health system that has grown through acquisition over time, how do you reconcile the MPID in Cerner versus Epic and your 17 different instances? So that's one layer. I selfishly also think communication is another layer. You don't want 50 different vendors texting and calling your patients. You want to unify that. And I'm sure the rest of the panel can think of other examples of platform level abstractions.
I would just offer the other end of the spectrum from the family community perspective, emphasizing access to data. I think we talk about data, but if the community you're serving and their families you're serving doesn't have access to data, then there will be no integration. And so accounting for what is that access to data from a platform technology perspective, access to data from a connectivity perspective, what is that access to data from even a resource perspective, being able to afford data plans. I think there's an assumption that everyone has an unlimited data plan and we can set them up with telehealth and SMS engagement where they're going to turn all of that off because they can't afford it. And so what programs or bridges within the community can you partner with to account for that and help ensure that there is access to data at the end of the day for them?
Well, I appreciate the answer, Jaden. I think it's really important because over the last year and a half or so, we've all lived the fact that we have gone remote in some way, shape, or form, including the ability for us to either acquire or provide care to patients. And really that remote movement has forced us to change some of the ways in how we interact with our patients, right? On many different fronts. You used to be able, for example, to ask the patient to come in and see you in the actual clinic or the hospital 2 or 3 or 4 times, and that became very difficult to accomplish. So the next question that I have for the panel, how are we maintaining devices? How are we connecting these devices today to enable the movement and maintain cohesivity, right, between the engagement of the provider and the patient? What are those steps that we're taking both on the hardware, software end of it, as well as the actual care of it? And maybe I can call on Dinesh to kick us off with that question.
Yeah, no, it's a really interesting time period for remote patient monitoring and this kind of advent of bringing technology and devices that can kind of bring objective data about healthcare in the home setting. If you flash back even a few years, the idea of just calling your doctor didn't exist. And then the idea of being like, here's the real data about my healthcare, make clinical decisions from home. The objectification of your home experience just never existed. I think we're in a really interesting time period for that. And, you brought up the point of how do these devices actually help in engagement or the management of that patient-doctor experience. I think that's actually going to be the biggest challenge right now is just going to your last question, technology, especially in healthcare, implemented for technology's sake is not going to work out. Patients just don't care. Providers don't care. The technology has to be a backbone. It has to be smoothly integrated in and help them accomplish something different. So I personally see a lot of interesting work happening right now in engagement and using these devices and connected care as input streams to the clinical experience, but not driving the clinical experience. The human element is still going to be what stays on top and keeps the conversation and the engagement going.
Thank you, Dinesh. Any commentary from the panel on this? Guy, anything from you?
How do you top Dinesh's great statement? Try not to take up too much airtime. I think it's actually the where RPM and communication and data integration come together that really magical things start happening. So that's part of the future that I'm most excited about. I think Jaden raised some really great points about access, period. I mean, he reminded me so clearly of, I think it was maybe a Wall Street Journal article in April of last year, where there was kids sitting outside McDonald's doing their homework because they didn't have internet access at home. So sorry, I'm kind of going back a question, but that image is still stuck in my head after listening to Jaden's response. There's fundamental access that we probably still need to think through, even to make some of what Dinesh talks about possible.
Yeah, I mean, health literacy and device literacy and technology literacy is something that we'll have to tackle now that we're trying to bring healthcare like through the digital world. Like some people just still aren't comfortable with video chatting. Some people are not comfortable reading and using an app to actually manage their care. Like, how do you bridge all these gaps? I love what MotiSpark is doing for that, right? It's like bringing the human in to say, hey, I'll guide you through this technology adoption.
Like maybe one of the only upsides of this pandemic has been this forced like consumer sort of engagement with telehealth and the provider engagement. But also even I think yesterday I saw that California is trying to reduce the digital sort of divide by giving all of these subsidies to even to many families to get broadband access. So it's slowly coming into policy. I'm sorry for going back as well, but I think that when
we're getting rid of all the questions, we're going to focus on the first question.
this having to do with the as a startup in this space that we deal with that engagement layer, but talking back to how providers can't have 10 different vendors and everybody needs to be able to speak the same language. It's taken us a long time to realize that we need to be an API based offering, and that our the digital health sales cycle is so utterly bizarre and different from our background coming from a consumer world, realizing that even if our target customer is X, that we need to go through all of these different vendors. And it makes sense because a large provider group can't deal with 10 different vendors. So but the expertise in one layer of engagement, probably at the creative sort of innovation front, is still, we believe, best served as a small company willing to take those risks. And so I think as a digital health ecosystem, how we can still support all these different niche efforts, but be able to deploy through FHIR and agreements that with different entities is a challenge.
And go ahead.
I was just going to add, Ariel, you made me think of maybe a counter that, even though I agree with what you're saying fundamentally, I actually think it's okay for a hospital or a health system or even a small practice to have a bunch of vendors. And to be honest, 100 probably sounds like a small number to people like Christian. They probably have many more, but it's how you think about those vendors. In software development, I love what you said about APIs. There's this concept that's really popular of microservices, and you're really creating a strategy around the application and the experience you want to create. And you're taking stuff off the shelf. Sometimes you're building it yourself, but you're using microservices to build to the end game. And microservices just all roll up into a strategy. What are you trying to build and why? And you don't want to build everything yourself. There's best of breed folks out there. Pick the right microservices that fit into the long-term strategy. And then you get, I think, really magical outcomes.
I think it's a very good point, Guy. If I can challenge that for just a second, just for the sake of discussion, I think the issue that we start to worry about has to do with how do you absorb all of it and actually make it fit into your ecosystem properly, right? Organizations already to some degree have somewhat of a struggle managing large initiatives that are relatively straightforward versus when you start talking about microservices, all the various different groups, departments, service lines, what have you. How do you make that whole cohesiveness come together? I think it's important, right? So I don't know if the panel has a response to that portion of the question.
I'll jump in if no one else is. I mean, to me, it's ownership and documentation. That's how systems scale. I don't want to minimize how hard this is. It's a big operational challenge. I mean, Amazon is the king of microservices. They've built a bunch of their own. They buy a lot of other kind of third-party vendors, Salesforce, Twilio, there are others that sit in their stack. And at the end of the day, your teams need to be able to go to a central repository, figure out how things run and what to use. The problem you run into, and I see this in my space, is that you haven't made investments at the platform level, at the enterprise level. You have silos that have made decisions, then things get messy. then you have 15 systems that are all trying to do the same thing with no standardization. And unfortunately for your patients don't see you as 15 different systems. They see you as one. And they experience their care journey with that one system. So they don't care that it's complicated. They want it to be simple. So I think it's, it's ownership, it's documentation, it's wherever possible, making decisions at the enterprise level.
That somehow, some way, we went back to question one, though. I just want to refer that again. So let's talk about, guiding the patient and making it seem relatively simple and easy, because one of the biggest struggles as patients, and we've all been patients to some degree, is being able to navigate the actual health process, right? So you show up at the hospital or you at the clinic, and then you have a service, and you're somewhat, I don't want to call it lost, but you struggle a little bit in being able to go from point A to point B. Now, add on top of it all the issues that we have from a pandemic perspective and everything else that complicates things. So how is technology, when we talk about emerging technologies, how is technology actually helping us support managing and being that care navigators for the patients from not just point A to point B, but potentially from start all the way till the end, and ensuring that not only they're getting the service, but they're being cared for appropriately and supported properly. So Jaden, if I can call on you to kick us off for this question, it'd be great.
I love this question. I feel it wraps in, questions 1 through 3. But, I think from, of course, the patient and family perspective, then we talking about the digital divide, and then now this need from looking at it from an engagement perspective. But what I think why I love it also as well is the central focus is why we all truly are here. We know there's obviously a lot of variables at play, but to serve the patients and families better and, provide the best healthcare and services to our community and to families and individuals that need, and as kind of that North Star. And so when looking at it from, well, how do you cross the digital divide? I think so much of that, all of us as humans, ultimately, you'll never replace an in-person interaction. Comes down to trust. And from our perspective of Family Proud, certainly, how do you empower existing community and organizations? There's a ton of support out there, and there's a ton of people that have been through the care journey before. There are a ton of people who do know how to navigate the care journey, but unfortunately, for 99.9% of people that experience an adversity, it's the first time, and so they're now faced with these burdens of care, emotional, the financial, the logistical, not knowing how to navigate that care journey. And so, when we talk about it from how do we deliver empathy through technology, is really how do we look at empowering already existing community to really enable and foster that trust within a specific community. So from a technology perspective, for us is how do we provide a technology that supports an already existing community to help facilitate that conversation, that engagement, sharing lessons learned with one another, connecting someone who, a quick use case, a mother whose son is diagnosed with cancer at a local children's hospital is now doesn't know what to do, who to talk to, but then the ability for this already existing community to connect the mom and the family to another family who's been through the support journey, is now later in that care journey, who's willing to reach back and provide that support. The ability to connect them when they're ready, the ability to connect them to the right resources through that organization. And also, how do you take that trust to act as a bridge and wraparound services with existing community resources? Is that a partnership with a local phone plan to provide that access to data? Is that access to care items? So it's really a cross-vertical discussion, I think from a business discussion, but at the same time, ultimately providing the best services for the family through trust, because that's the same thing, going back to the social determinant discussion. How do you account for what's actually important for that family? A caregiver or a family in La Jolla, San Diego is very different than Central Valley or a rural community in terms of what those needs are. What is the trust, what language they speak, the culture, once again, all the community variables in providing the best possible recommendations. So, I think the discussion, how do you empower, I think the point being, how do you empower an existing community or support group, not replicate, but really complement and, to provide the appropriate support to the family.
Absolutely. I had a second part of this question too, and I'd like to address that as well. So in your opinion and the opinion of the rest of the panel, how far away is technology really from adapting to our connected worlds to create that sense of empathy, right? So it's one thing to be available. It's another thing to be available with care, with a sense of, connection and passion or what have you. How is technology doing that?
I certainly think that there's different phases to this. I think those who have a high level of competency from a technology standpoint, trust in technology, have a stronger community, will be faster to adopt. So certainly the conversation circles around adoption. And then there will be communities who don't trust technology to begin with. They may have a really strong community, but they don't trust technology. So how do you, those will take longer period of time. But the research and data shows, certainly adoption of, even when you look at it from a Medicaid population, adoption of mobile devices versus desktop. And so once again, going back to the access piece, providing the ability to access that through technology. Most everyone has mobile devices now, so accounting for that divide as well. But I think there'll be a phase plan. I think in terms of like targeting efforts in specific communities, will be obviously technology savvy and stronger community around the culture that they have.
Can I bring some, right now there's numbers of like views of hashtag diabetes and hashtag mental health on TikTok that are like in the billions. It's mind blowing. So I think recognizing that consumers or patients are looking for content, and they're looking for empathy, and they're looking for like the what Family Proud is giving, but they don't feel the empathy from the existing outreach from their providers, presents a great opportunity, because it's about content format, tone, and approachability, I think. And it's not even so much the technology, but is like gaining that sort of like empathetic touch through the technology.
No, you're absolutely spot on. Part of it has to do with how much you communicate, what you communicate, right? The format and how you communicate it, the value of what you put on that communication content. I mean, all of it has a lot to do with building that somewhat empathy, because I'm not sure that technology will ever offer it, right, in the way we understand it as humans. Any last, go ahead.
Technology, I think, empathy, you're either born with it or you're trained. Like doctors have classes on how to interact with their patients. And I think at the end of the day, the humans can control it, but you can screw it up with technology. And I'll just give a quick story. I've spent, my life in the sun. I have a lot of moles. I get them removed every year. I had one removed recently, and I got a letter in the mail that said I forget the medical term, basal cell, the one that's not as bad, but I had it. And I read it and I didn't understand it. I got it in the mail. I opened the letter. My mom's a doctor, so I called my mom, and I literally like FaceTimed her, and I showed her the letter. I said, "Mom, do I have cancer?" And she said, "No, well, you did. They removed it. They could have probably left it there for 50 years and you would have been fine, but you did. It's fully removed. You're good." But that's an example of you screwing it up with technology, right? The EHR had that information. They had a process in place that sent it to a letter. The letter was mailed to me. I read it. Luckily, my mom's a doc. But you think about Jaden's communities, right, where that might not always be the case. That's a much worse situation. So anyhow.
I mean, I think you nailed it on the head. Technology is more likely to screw it up than anything else. To be honest, empathy, it comes from people. All the reasons people use technology is because they want to hear other people, talk to other people, interact with people. And that's where all the empathy comes from. So I think it's our job as technologists in healthcare to keep the layer as thin as possible, highlight the human on the other side. And the technology should almost empathize with the fact that the patient doesn't want to use technology. That should be the empathy. It should be trying to get them to the doctor, get them to the nurse, get them to the answer, get them to the content that they want to see, and then get out of the way. I've seen so many companies that try to highlight the tech, and it's if you do a good job, I think the tech highlights the people.
All really good points. And just in the interest of time, I want to make sure we get to this next question where I think technology does make a difference. And really, when we were looking at this question, it's what kept popping up in my head. Can you hear me now? Right, the cell phone commercial, and really, it speaks to the fact that communication, for as long as any of us, I believe, can remember, it's an age-old problem, right? Where it's like, you don't communicate enough. You communicate too much. You're not giving me enough information. You gave me too much information. Then I got a letter in the mail and I couldn't interpret what it meant. And then I had to call somebody else and talk to them. Oh my gosh, right? And it just goes on and on and on. So healthcare services are increasing on a daily basis, right? There's more and more enabled platforms that really allow that communication between the provider, the patient. How do we get to a level where that information is maintained appropriately, I'm getting what I need, I'm able to reduce the noise that's coming in on a constant basis, but yet I'm offered a solution, I'm offered an opinion, and I'm given some path to get additional information as I go through it, right? Really creating somewhat of an ecosystem. So if I can ask Guy to comment on it first and then open it up to the panel. Guy, what are your thoughts on that?
Well, and we've talked a little bit about this, Christian, but for me, this is just an area that has to be an enterprise-wide platform level investment. You talk about microservices. This is one of your core microservices every hospital needs to have. What is your patient communication strategy? What is the HL7 feed for communications that everything flows through? Now, behind that, you need to have some serious tech that knows how to route patients to the right person, ideally routing them super efficiently. A workflow engine where you can manage all the rules at scale. And that's where the empathy comes in, really be really thoughtful. Like, what are the rules? Don't send a letter, don't send a text, don't make a call that is a robot telling you they found basal cell. Like, that's a bad idea. And there's honestly 90% of the work is probably there. But to me, this is one of those areas that has to be that microservice level investment. It has to be done at the enterprise. It's how you meet patients where they are. And I would caution folks not to orient their investments towards automation. I know scaling is tough. I know that margins in healthcare aren't always great, but automation isn't always the answer to the problem. The problem that you described, Christian, is people are calling, they're not getting their answers, they're getting bounced around. It's inefficiency. Right. Let's solve for the inefficiency. We can still do it with humans. And I really, really believe in the human element. So I don't know if folks have other thoughts.
What about the rest of the panel?
Yeah, definitely agree. And I think, harping on it is also another consideration is certainly these kind of feedback loops, or, from executive leadership down to the patient level, making sure that we are always putting the families at the forefront, but at the same time, how are we receiving, making sure that we're listening at every level, what is the PFAC saying? How are we actually receiving feedback from families? Are we asking them the questions? That's not just an automated survey that's pushed out by a SMS or a robot, but are people actually asking families at different touch points, and, not just during care, but post discharge different points, as follow-ups when they're more in a better mind state to answer those questions and provide valuable feedback, and try to identify as much that you can close the loop back to improve that process, and identify where can there be value of a human touch or workflow improvement, where did we lack empathy, to look internally to make those improvements.
Now, Ariel, can I call on you just to provide a bit more from a content perspective, right? How do we motivate so that communication that we are having back and forth with the patient is reaching them in a way that they can absorb and potentially not cause them to, I'm going to use the word freak out a little bit, right? Or get concerned, or then, what should have been a mode that allows them to get enough information causes now 5 other phone calls and more appointments, what have you. Can you speak to that a little bit?
Sure. Yeah. And I think it kind of goes back to the very high engagement rates of consumer driven searches through like YouTube and getting misinformation, all of that, is that people want content in formats that they can digest, that are engaging. Someone once told me that, like, this expression, you should do this, to create, nobody wants to hear something that they should do, and just spinning it like you don't should all over someone. And so the communication tone format, we look at, no video should be more than a minute long, ideally, between 20 and 40 seconds, and the cadence, and even if it feels like a fallacy during the planning of like a user journey of someone being diagnosed with cancer, giving a sense of self-efficacy and choice, and how the end patient is getting the patient education or content, even just a sliver of choice, builds trust. And I think the magic of being able to involve like real community members is super challenging for all sorts of legal and reasons, and I'm so inspired by Family Proud. Building community trust and like evidence-based education together is truly magical. And then, sorry, jumping to another topic, but that is related, talking about the noise of consumer-driven wellness applications and education. I think there's this notion that patients are getting a lot of value out of wellness apps, but the data just doesn't back that up. I mean, people might enroll themselves in things, but these, especially like a lot of employer-based wellness programs, it's just not having the outcomes that they promise.
So let's take a slight maybe right turn on this topic. We're still related to wellness platforms and apps and connectivity, what have you. What about new changes that are coming down that allows various different application creators and makers, what have you, and platforms to plug into your systems, right, in order to pull data out and deliver that to the patient? How, from an emerging technologies perspective, what's your point of view on managing that absorption? I just saw Gizer's facial response to this, and the ability to maintain things properly. You know, what's your take on how to deal with that kind of movement? From the ability of the applications being able to plug into your systems and pull information out and be able to deliver to the patient.
Ariel,
Go ahead, Jaden. No, go
thanks.
ahead.
Yeah, I was just gonna say, I think Ariel nailed it there too, in terms of that choice. And obviously the content that they're creating is awesome to have that. And that ties back to the empathy aspect, that ties to the trust aspect, it ties back to the divide aspect. But I think really to any new technologies, you know, from permission settings to data privacy, transparency in those choices and decision making are all, you know, part of really, you know, in terms of being able to have the highest impact for the patients and families you're serving. I think the trust and the transparency of those decisions and how it relates to, you know, the usage of your data, of your privacy, how that integrates with your health records, all of the above. The more that you can empower, once again, back to the individual, provide them that choice, and the content that they're receiving and the engagement that they have or don't have, I think is where you'll see the greatest success.
I'm a huge believer in, you know, making easier access a reality, both for healthcare vendors and for patients, with the right security safeguards in place. I think I'm a little more glass half empty on this one. I just haven't seen material changes on my end with folks I try to integrate with. The plea I have to the folks in this group who I think the same way, and others like us, is to lead by example. You know, we have APIs that we make accessible. They're all free. That's leading by example. I still, you know, try to do integrations sometimes, and my partners get hit with $30,000 fees, excuse me, for an integration that honestly takes 2 hours to spin up. That just drives me mad. You know, ever since, you know, the Interoperability Act came out, I've actually seen fees increase with some of the folks we integrate with. So I think we need to lead by example. I think there's I think it's unfortunate, and it's so important that data becomes more accessible. There are other ways to monetize. We need to promote an innovation economy, and data is at the center of that, with the right safeguards and permissions. I don't want to set any of that aside, but I just would urge all the folks who have the ability to do so to lead by example and try to make access to that as easy as possible.
So let's take that to the next level a little bit on this question. There's a lot that are trying to break into the market space, right? There's a lot of pressure that's happening from resellers of platforms, applications, what have you. Maybe speak a little bit to us about how do you make that entrance into the business, right? How do you actually differentiate your solution from another solution, and why, right? What's your approach to making that happen?
You want to start with me?
If you want, go ahead.
I need to think on that one. I look at the startup costs to coming into healthcare aren't insignificant. You know, like these data standards in healthcare, they're not standards you learn in CS. Like, we hired out of the EHRs, right? Folks who did this for a living, who understood HL7 and FHIR and Smart on FHIR and flat files and interconnect web services, like that costs money. The startup cost for how much cheaper it has become to innovate, the startup cost to actually integrate meaningfully into healthcare are not insignificant. And then once you've got the integrations done, then it's just the unique value proposition of your product. So to me, integration has always been step one, getting the right data and then creating the value prop for your specific product, right? In my case, it's abstraction. It's trying to deliver a platform that integrates into many, many different solutions that makes, healthcare executives' lives easier. For each of the panelists in this room, it's going to be something a little bit different, but the startup costs aren't insignificant.
How about others on the panel? Any commentary on that?
Yeah, I think the focus on integration, not only from a software like HL7 style integration, but like actually integrating your product into the clinical workflow and experience. Healthcare is, I believe, not a product oriented marketplace. Like you don't have, I'm not saying anything rude, but you don't have to be the best product to win. You have to be the best integrator into the system to win. And so focusing on how do you do the tech integration? How do you do the actual human integration? How do you do the sales integration? There's a reason why the old guard does so well. It's because it's about the working with healthcare. And so focusing a little bit more on that and focusing a little bit less on product, I think is not a horrible advice for early stage founders trying to find their footing.
Anyone else? Jaden, anything from your side?
Yeah, I think the biggest thing there, and they said, is the integration aspect, and also identifying partners that are willing to innovate. There is a lot of, whether it's a joint venture versus a service agreement, looking for enterprise or organizations that are willing to innovate, whether it's in a joint venture fashion, and starting there. And once you have the data as kind of that foothold, then it's a lot easier to have follow on.
Jaden, that's interesting. You made me think about innovation and how innovation happens. And let's step outside of healthcare for a second. When you think about the traditional product development lifecycle, Agile, Scrum, innovation doesn't happen with a 52-page requirements document. It doesn't. It's a problem statement. And right. I'm sure every single one of you has been given long RFPs. When you think about meaningful use, the ACA, that was just like a checklist of features to build. So why do you think a bunch of products came out that solved for a bunch of features and didn't solve the problem? So that's another area that I think is interesting, which is, what is the problem? And I think that's the way healthcare organizations can help us if they truly want to innovate. Describe your problem really well. Don't describe how you want it solved, because the truth is we won't know how to solve it until we really understand the problem, put engineers on it, and look at all the technologies available to solve it well, efficiently, cheaply, quickly, et cetera.
Well, I think what you just described, sorry, Jaden, just real quick, what you just described, Guy, is essentially the communication aspect of things, right? Being able to speak your problem so we can define a solution to it, right? A lot of times an individual or an organization with a problem comes with a solution before they even tell you what the issue truly is, right?
And the sign of that's an RFP.
Yeah.
If you go to market with an RFP, you're already doing it wrong,
Fair
in my opinion.
Fair enough. Jaden, I didn't mean to cut you off.
Yeah, no, I was just going to add, and so, something to be open to as well from the organization perspective is the fact that, a young, innovative company may actually help you identify problems that you don't see. And so being willing to work with them to help identify some of those problems and potentially then be able to ensure and really allow them access to talk to those on the ground level to once again, listen to what the problems are to help identify a solution together in that joint fashion. So whether that's, phase 0 of working with social workers, the care navigators, whichever problem set or area that you're focusing on, and probably be uncovering other problems to be able to help craft that solution as well.
Very true. So let's take maybe if we can wrap our discussion up with, what about the security aspect? And all of you touched on it in some way, shape, or form as you're answering your questions, but where are we from a security standpoint? Because this is a concern. It's a real concern for almost everyone, whether you're a platform that plugs in or a platform that is taken home in the sense of a smart device or a healthcare device of some sort. How are we maintaining that security aspect of it properly from the time the product is created, delivered, maintained, and that loop back all the way from the patient back to the provider and vice versa? What's your approach to it?
Tying this and the last question together, because you just made me think of
Well,
one.
we built these questions like this on purpose, Ariel.
Yeah,
To
right.
build up.
I mean, it actually like the challenge, like the challenge for that early stage startup to be able to do the iterative improvement in an integrated way with actual local providers, like we've done. We've had like, it has been an incredibly challenging situation because of the compliance and the security concerns. So we've had to create this sort of way of being a broadcast platform, so as not to be to fall under the two-way communications, but take the content from the provider. That's not the end goal, but to have the money and the time to get to that two-way communication at scale is something that takes like a different sort of workflow that at the beginning process.
I kind of feel like the security aspects are maybe a bit overstressed because we live in outside of healthcare, we live in a time period where we're doing all sorts of high sensitive actions, and people can start up a company and have an API and integrate in a secure way that's robust enough, and they're good to go. You know, like they're off to the races. I feel like if integrating data and getting out of like every company today spends time like building the operation to integrate data to then do their value prop, as Guy was saying. If they just spent their time doing their value prop, they'd probably be better off. And I think this is really clear in healthcare because I don't think anyone says insert EMR name is an easy place to integrate with. Insert hospital system, they're really easy to integrate with. I mean, like very few players are finding themselves as the innovative leaders of saying, we are easy for value providers to come to us, quickly get what they need, quickly transact what they need, and then generate value for the patient or for the clinical provider. So I feel like we point at security. I think it's a scapegoat. I think that the ease of integration is available today. I just don't think the economics have really pushed it into the forefront.
I'm going to answer your security question, Christian. I want to weave it to Dinesh's answer, if that's okay.
Sure.
I'll share my playbook because it was really simple. When I started, I used the safe harbor method of data de-identification, which was the cheapest way to do this and meet rigorous standards. Would it stand the test of USC's security team? No, but there are others who it would have, smaller players. Then as we scaled, we invested almost immediately in a dedicated CISO. We now have multiple people on our security team, full-time roles. I spent over $1 million on my initial high trust audit. The renewal every year costs a ton of money. Now we're doing ISO, we're doing GDPR, we're doing PIPEDA. Like, it's expensive. But that safe harbor thing at the beginning is how we got to escape velocity. And then we raised money and we invested a ton in the security component. And it's, you know, that's the only way to actually scale to commercial success is the integration, the security. So I'm right with you on that. There's a way to do it, but you will have to spend millions of dollars.
No, absolutely. It's not an easy task, and it's a lot of work to do. But we are at time. I do want to acknowledge all of you for participating today. Thank you so much for a great discussion. I think from an emerging technology perspective, the evolution will never end, right? There's continuous improvements, whether you have a platform today, you're thinking of creating a platform tomorrow, the way to integrate, to secure, to manage data, to communicate, to connect with the patient will continue to evolve over time. Thank you all very much for participating. And for the rest of the participants on the conference, please stick around for a very interesting conversation coming up on the clinical workflow. So thank you all very much and have a good rest of your day. Bye, everybody.
Thanks for having us.
Thank you.
Thank you.